Happy Friday, everyone. Thanks for joining us on the media briefing for this very toasty Friday. We've got a great lineup for you today, and we're going to get started with Emily Hickok with our District Attorney's Office, who's going to talk about a very unusual issue or something that's become an unusual issue with our pandemic, which are wedding receptions. Hi, Emily. Happy Friday.
Hi, Maya. Thanks so much. Again, my name is Emily Hickok. I'm a Deputy District Attorney in the Monterey County District Attorney's Office. And we wanted to join today to ensure that business venues and the public understand the current restrictions on gatherings at this time. So the District Attorney's Office has received multiple complaints regarding venues that are planning to host wedding receptions. And we wanted to clarify that California's stay-home orders, which are applicable, of course, to Monterey County, currently prohibit professional, social, and community gatherings, which are defined as meetings or other events that bring together people from multiple households at the same time in the same location for a shared or group experience, even if that location is outdoors. And this is, of course, because these types of gatherings pose an especially high danger of the transmission and spread of COVID-19. Now, there is an exception for faith-based services and cultural ceremonies, as well as protests. The health orders currently do not prohibit outdoor faith-based services, cultural ceremonies, and protests so long as face coverings are worn and social distancing of 6 feet or more are maintained between people from different households at all times. All other social gatherings that are not otherwise allowed under the orders are currently prohibited. So what this means with respect to weddings is that ceremonies would be allowed, again, outdoors, socially distanced, wearing appropriate face coverings that cover your nose and your mouth, so long as members of different households maintain 6 feet of distance. But wedding receptions are not currently allowed. That means if anyone was to attend an outdoor ceremony, the guests would have to leave after that ceremony and not stay for any other activity. These orders are, of course, in effect because Monterey County remains in a state of emergency due to the spread of COVID-19. So we hope that with this education and outreach, business venues understand these restrictions and the public understands and will act in accordance with them. Certainly for those businesses who do not comply, there is the potential of administrative, civil, and criminal penalties associated with violating these public health orders. We want to thank those businesses that are complying and recognize the tremendous sacrifice that businesses are making, that we're all making during this emergency. If anyone has any information that they want to share, they want us to follow up on any, you can email our office at consumercomplaints@co.monterey.ca.us. You can email in English or Spanish. Thank you.
Thank you, Emily. And if you would stay on the line for any questions we might have from the press after all of our presenters are done. We're going to move on to Karen Smith, our favorite health department PIO, who's going to share some information about the Optum sites and then also about heat safety. Hi, Karen.
Hello. So our Optum sites are our Optum Salinas site, which is currently located on Abbott at the Agricultural Commissioner's office, and they've been wonderful to host us, is now moving to the Cesar Chavez Library at 615 Williams Road on Tuesday. The hours are going to stay the same, and it's Monday through Friday, 7:30 to 8 p.m. Still need to make appointments, and you can find that information on our website. So we're excited about moving closer into neighborhoods for that one. So we are under an excessive heat warning, and the health department just wants to remind people to drink more water, non-alcoholic, regardless of your activity level. Don't wait until you're thirsty to drink. Just drink water. Caffeine, alcohol, large amounts of sugar doesn't help. The best thing you can use is plain old water. And we're also encouraging people to stay indoors and, if all possible, stay in an air-conditioned place. If you don't have air conditioning, there are sites in the county that will be opening for cooling centers. Currently, we have one. There will be one in Greenfield. That the Greenfield Fire Department is setting up. We don't yet have an address or the hours. There will also be one in Gonzales at the Fairview School Gymnasium, and that's open from 11 a.m. to 3 p.m. That's in Gonzales. And there are two that we're trying to confirm. One is the King City Library, and the other is Carmel Valley Library. So really try to keep yourself cool. I know it's a bit of a challenge. Some of the other things you might want to think about is wearing light-colored, loose-fitting clothing. Check on your friends, your loved ones, the elderly, your neighbor, anyone who might be at risk, and make sure they're drinking enough water and that they're not suffering from a heat-related illness. If they seem confused or if they look like they're suffering from heat strokes or heat exhaustion, go online, take a look what that is before you go over, obviously. And just be aware and don't be afraid to call 911 to take care of those individuals and cool them down. Also, when you never, ever, ever leave anyone in the car, not even for a moment during this heat wave or at all, make sure your animals have plenty of water and shade if they're outside. And if you have to be outside, if you can, limit your activity to the morning and evening hours. Try to rest often in shady areas. Wear sunscreen. And again, I'm coming back to the same one. Drink plenty of cool, refreshing water. And that's it from me.
Thanks very much, Karen. Please stay on the line in case we have any questions for you. Now we've got Lee Takakawa from Cal Coastal, one of our county partners, who's got some good economic news to share about small business disaster loans. Good afternoon, Lee.
Good afternoon, everyone. Thank you for having me. I do have an update for everyone and an announcement that the county has just received notification as of July 23rd of a huge award. It's $1.6 million through the Department of Commerce. It comes from the Economic Development Authority. It's $1.6 million through the CARES Act. Many of you have heard about the CARES Act and the stimulus funds that have been helping many organizations through the pandemic, as well as small businesses. So in addition to the $1.6 million to recapitalize our revolving loan fund through the county, it also came with some administrative grant money to help us operate the fund. So we're very, very pleased. It's still in the works right now. It'll be going to the Board of Supervisors on their agenda. We're planning for September 15th to go for the authorization to accept the award, as well as a slight tweaks, amendments to our existing administrative plan to run the fund. As many of you have heard, we developed an emergency microloan fund due to the crisis that many small businesses in our community in Monterey County have gone through. We structured a microloan fund of $25,000 and less to give quick, small loans to small businesses with nine months of initial deferment period. And then also at a very low interest rate of 75% of prime rate. So it was at 2.44%. This was an excellent tool. We ended up doing to date 19 loans for $426,000 roughly. We received a little over 30 applications, so we had a very good success rate in approving and funding those loans. We also saved 80 jobs as a result of our existing effort. There's still about $234,000 left in the fund, but we will be getting the $1.6 million shortly from the EDA, the Department of Commerce. So we're very excited to announce this. I have to thank Congressman Panetta, the County Board of Supervisors, and also county staff. I've worked really closely with Anastasia and Darby Marshall, who have been very supportive as we process many of these small business loans. The pipeline has since died. We started out with a big bang as businesses were very worried, but as restrictions started loosening, the applications have stopped. So with these new funds, we hope to help many more businesses as this pandemic is lasting longer than we all expected. There's economic damage still to many of the businesses, and we're going to be able to make larger loans with this new injection of funding. So it won't just be little micro loans. We're going to be able to actually make loans of up to 400,000 at maximum, but they do have to be show economic injury due to the COVID-19 pandemic and a recovery plan to be able to recover post-COVID once we make these loans. So there are some requirements. We are pretty flexible with the collateral that these businesses pledge. We're trying to structure them to give them an opportunity to recover. There will be failures. There will be business failures. This is getting very serious. You can see that Monterey County, we're very tied to the tourism industry. We have many service and retail type businesses, small businesses that are just barely hanging in. So this is an excellent tool, excellent news. I'm very happy about that. And if they're hurt by COVID-19, we can, even though they may be larger loans up to 400,000, we're still going to do those at 2.44% through this pandemic. Once this pandemic is over, we'll revert back to what we normally charged, which was about 6 to 8%. So this is a huge reduction in their costs of borrowing, and we even waive the application fees for businesses showing economic injury. If they don't meet our requirements, then we can just do a regular loan through the program, which again has a higher interest rate. And as you know, with the 25,000 and less microloans, we've been able to do a quick turnaround time of anywhere from 5 to 10 business days from application to funding. With the larger loans, it's going to take more time because we won't have the delegated approval authority that my board of directors has granted me here at Cal Coastal Rural Development. It'll likely have to go through a full loan committee and board of directors approval, which adds a couple weeks to the turnaround time. But anyway, I do want to just remind everyone, if you have small businesses that need assistance, Cal Coastal has many other loan programs from 5,000 up to 5 million. We also have a small business development center here in Salinas that's through the pandemic, they put on 33 webinars and seminars with Monterey Business Council as a partner in the city of Salinas to deliver our message. So we're asking that the media help us deliver the message. We're preparing to take new applications with the new funding, but there is some administrative work we have to do to get ready. And we do need the Board of Supervisors for it to go through the approval process for the Board of Supervisors. So with that, I'll say that please send them to our website, www.calcoastal.org. And on our website, we have a pre-application process where they can send us what they need, and then we'll pick a program and make sure we tailor it to them. If they're looking for a Monterey County revolving loan fund through this disaster program, they can specify that in the notes, and we'll return their call and help them. One other note is just to let the media know, we had carved out some of the existing money that we already have for the South County. And we ended up funding only 4 loans for about $95,000. We had set aside $200,000 at one time, but there's still money left, existing money, the $234,000. So it never really got fully used as PPP and other emergency disaster programs kicked in. So some of the businesses were redirected to some of those other programs, but I'm pretty proud of our accomplishments and the county's effort and the congressman's effort to provide a resource that's really affordable and quick and for our community. So thank you.
Thank you very much, Lee. And if you would stay on the line for any questions that we might have, we're going to go to our last presenter, Dr. Moreno. Our health officer has been able to join us, and he's going to give us an update on the backlog of cases from the state. Good afternoon, Dr. Moreno.
Hey, good afternoon, man. All right, so yeah, I'm available for questions today, but I do just have I guess one update, and that is on the issue that was shared by us and reported by California Department of Public Health about the COVID test results that are reported through the state's statewide electronic reporting system. So as was shared previously, the state receives lab reports from laboratories. The state receives them electronically, and they get populated into the CalReady statewide system. And we at the local level and those at the state recognize that there appeared to be a decrease in reporting that was not consistent with our recent experience with case rates. And they looked into that and identified that some laboratory test results were not found in CalReady, were not available in CalReady. And so they determined, again, that one of the larger commercial labs that is testing for COVID-19 had lost its certification, which allows for the automatic transferring of test results to the CalReady system. So that was corrected, and those test results have been coming in. So between Friday of last week through Thursday yesterday, over 7 days, what we've determined is approximately 2,400 cases were backlogged and came through CalReady and were available to us. And so what we've been doing for the last week is, in addition to entering our current cases, our recent cases, we're also entering the backlog of cases. So we're doing that. It is, as you can imagine, taking quite a bit of our time to bring these cases into our side of the system so that we can assign them to case investigators. There are some cases that, as you can imagine, an individual may be close to the end of their isolation period or ending their isolation period about the time we're calling them because of the delay in the reporting from the state. So in those situations, we'll take the opportunity to make sure that they're doing well, and then we'll also work with them to identify the close contacts that they may have exposed and offer assistance in notifying those individuals and making sure that anyone that still would benefit from finishing their quarantine period do so safely. California Department of Public Health has asked local health departments to continue to look at our data to determine whether or not we believe that there are some labs that may not be reported to us yet, meaning that there's still work to be done at the state level to bring in more laboratory tests that they haven't yet. And so all of us are looking at our data and we'll be reviewing it to see if we believe that there still might be some test results that have yet to be reported through CalReady to us. In terms of the our case investigation and contact tracing, we have about 75 trained investigators, and that doesn't, so these are people who are both case investigators and also contact tracers. So, and we have additional people who have applied to take on part-time jobs with us, and we are looking forward to interviewing additional people to bring them on. And with our new supervisors, we'll be able to spread the responsibility of supervising this important workforce as we move forward. We also have some additional office assistants who are providing additional support. And then finally, because of the lack of data transfer to locals, the state has not yet posted the has not repopulated the county data monitoring table, and so but I can tell you that our case rate still is at a point where we would not be able to open schools within classroom instruction at this time. And the most recent business activities that were terminated because of the us being on the monitoring list will continue to remain closed. So again, many of the restaurants, for example, can still operate, but they'll still have to remain in operation for takeout and outdoor activities for now. And we just hope that hopefully soon, the state will have enough information or will have transferred all or nearly all of the laboratory tests that were backlogged to the locals. And at that point, hopefully the state will then begin to recalculate the metrics and post those metrics for locals to use in decision making. Thanks, ma'am.
Thank you, Dr. Moreno. And that's all of our speakers. So we'll go ahead with questions that we've received. And the first question is for Dr. Moreno. Is County Health offering any COVID-19 safety guidance for masks, et cetera, for beaches or any other outdoor sites, including guidance for tourists?
Whoops. I'm sorry, man. Could you read that one more time?
Sure. Is the health department offering any COVID-19 safety guidance or advice related to masks or other for beaches or any other outdoor sites for both locals and or tourists?
Yeah, so I think that probably falls into our PIO function. So maybe Karen Smith would be able to provide a response to that.
I could do that. So earlier this month, last month, we began to work with the hospitality industry to reach the tourists and remind them that there are face coverings and you're supposed to social distance and the usual guidance. I'd just like to take this moment to remind people that the mask requirement or the face covering requirement is statewide. So this should not, the face covering guidance shouldn't come to as a surprise to most of our visitors or our locals that come here. So the guidance is the same. Don't gather, wear your masks, or your face coverings, stay 6 feet apart, and certainly don't gather with people who are not in your household.
All right, thank you very much, Karen and Dr. Moreno. I have a question for Emily. Emily, you mentioned businesses that are hosting large gatherings and how to report them. We also know there have been large parties hosted by private property owners. How can people report those, and how would those violations be enforced?
Thanks. So complaints against businesses that are violating the requirements, which would be unfair competition, would place businesses at an unfair advantage over those that are complying. Those should come directly to the district attorney's office. For complaints that are against private people, those should be directed to the local law enforcement agency so they can respond and investigate those complaints as they see fit, and then potentially refer them to the district attorney's office for potential prosecution if that were to be appropriate.
All right, thank you. I have a question here, but I'm not sure there was anyone on the call to answer it. And if so, we will forward that to the right person. Who processes administrative citations for violating face covering orders, and how many fines have been issued or collected so far? I don't think we have anyone on the call from the county who can discuss that, and each city would have their own process for those administrative fines, and I'll forward that question.
I would comment that as far as additional administrative liability, I can't speak to what individual counties are doing, so you're right. But there is also potential enforcement powers that the California Department of Alcoholic Beverage Control has with respect to businesses' liquor licenses and so forth, if they are found violating the public health requirements. Also, Cal OSHA has certain enforcement provisions if businesses that are violating those requirements. So in addition to kind of cities that have their own administrative enforcement, those two state agencies also have administrative enforcement abilities.
Thank you very much for adding that. That's something we don't think about, but they've certainly been around in Monterey County. Moving on to our next questions. This may be for Dr. Moreno. Are there statistics on the hospitalizations for COVID-19 in Monterey County? And is it true that the majority of hospitalized cases, about 86%, are Latino? And I think that may be information we refer people to the state website. And you're on mute.
Thanks. Some information is at the state website, and that's hospitalization, typically hospital bed census, ICU census, PPE, and staffing. We do have available to us information from the reporting of cases to us, demographics, which include race, ethnicity. So we do have on our website, and it's towards the bottom of our website, information about what we call severe cases among Monterey County residents. And so at this point, we do have the categories of Asian Pacific Islander, Black or African American, other non-Hispanic, white non-Hispanic, Hispanic or Latino, any race, and then unknown because they're under investigation. We have those categories, and we've been able to, over time, provide category-specific information. And if we don't have very many cases, we group some of the categories together and report on the group. So there are enough hospitalizations among Hispanic Latinos in Monterey County that we can report specifically on that group. And we know that from the information that is reported to us, information that's shared from the people who are actually infected and hospitalized, 84% of hospitalized patients are among people who are reported to be or admit that they're Hispanic or Latino. And if we look at the estimated proportion of Latinos in Monterey County, that group makes up 61% of Monterey County population. So the Latino population is overrepresented or disproportionately impacted when it comes to hospitalization, which is one measure of morbidity or the impact of health and population health. So we do have that information. So it's 84%, and we just updated this a couple hours ago. We also have information on fatalities, and among that same group, 78% of the deaths in Monterey County associated with COVID-19 are among the Latino population. And again, that population makes up 61% of the Monterey County population. So again, with regards to mortality, based on the number of fatalities in Monterey County, the Latino population is overrepresented or disproportionately impacted by in the area of deaths due to or related to COVID-19 compared to other populations, Mia.
Thank you very much for that information, Dr. Moreno. A question for Karen. Is the Greenfield Optum site staying in place? Are there any plans for moving it in the near future? And if so, where would it move to?
There are currently no plans to move the Greenfield site. It's going to stay at the Greenfield Library for the time being.
All right, thank you. A clarification question for you, Dr. Moreno. You were talking about some of the backlog information. The reporter would like to confirm that Monterey County has another 2,400 cases since July 25th that are as yet unreported?
So yeah, thank you very much for the question on clarification, which I welcome. If I misspoke, I'll try this again. So we have approximately 2,400 tests that were not reported in Calgary that are now available to us. So of those tests, we're estimating that about 600 will turn out to be cases where the test was positive, and the remainder we anticipate will be those that had negative tests. So that means that, and that goes back to, I believe, July 27th. And so we have 600 new cases we anticipate over the last 7 days. So on average, it's about 100 per day over the last week, but a lot of them came in over a 2-3 day period. And then they the backlog started to decrease for the last day or so. As of yesterday, I think we were still receiving a few backlog cases. Today, as we're looking at the data, it doesn't appear that we're getting old test results. Old test results. And what we received today in Calready appeared to be most recent positive and negative test results. So thanks for asking the question.
Thank you very much. Another question for you, Dr. Moreno. What has been the impact of the delay in the test results reporting, including the local impact on the delay in test results reporting, including on contact tracing?
Sure. So when we receive the test results, we look at the positive test results, and that's where we're going to take action. And it starts with case investigation, and that's where an individual will use the information that's been reported to us to attempt to make contact with the individual who tested positive. So as we continue to call upon individuals who most recently tested positive in the last 2, 3, 4 days, we are simultaneously attempting to get a hold of people that tested positive going back as far as July 27th. And so the impact would be if we assigned someone who was tested positive July 27th to an individual yesterday, then at least 10 days have passed. So again, the impact would be we did not have the opportunity to, in most cases, to talk to that individual while they were still infectious and would otherwise be in an isolation period. We lost that opportunity. And so what we hope to find, and in some cases we do, that the person is already isolating. And there's some reasons for that. One is that the providers, many of the providers in Monterey County are still calling their patients and letting them know the test result, like they would letting a patient know what their blood sugar is, what their cholesterol is. They're calling and saying, you were tested, I tested you, and you tested positive. And then would have given instructions. So someone who has an elevated blood sugar would be told to exercise more and eat more healthy. Someone who tests positive for COVID-19 would have been told, hopefully by their healthcare provider, that they're infectious and they need to isolate and stay away from other people during their isolation period. So some people are already isolating. The other group of people who would already been isolating were people who may have been part of an outbreak investigation that by talking to family members, we might have identified other family members in a household who had developed symptoms. And in those cases, we don't wait for a test result. We go ahead and tell the individual that it sounds like you were exposed and you now have COVID-19 and now you need to isolate, and your symptoms started on Monday, so you have 10 days from Monday to stay in isolation. And some of those people, when we get the test result, we look it up and realize, oh, we already talked to this person because they're part of an outbreak. So some of these people will have been in isolation already, and we would have identified close contacts as well. But unfortunately, that's not true for all of these, and we anticipate that quite a few of these individuals may not have had the benefit of receiving direct instructions from a health provider or from us because we weren't aware of it. So I think that's primarily the impact. But as I mentioned earlier, when we do get a hold of them, and if they are ending or have finished what would otherwise have been their isolation period, there are still some people that may have been in close contact with them who should still continue to be in quarantine. And those are the ones that we're going to do what we can with to get them into quarantine, so that if they do become symptomatic during their quarantine, they're not out and about, they're not in the work site where they could potentially infect other people when they become infectious. And we get these people at home quarantining and away from other people.
Thank you, Dr. Moreno. Another question for you. Is there any indication that visitors and tourists coming to the Monterey Peninsula have led to more cases of COVID-19 in Monterey County?
So a very good question. So we do know that large gatherings in a variety of settings have resulted in increase in numbers of cases associated with those gatherings. The events that we tend to have here, well, we haven't had a lot of very large gatherings here in Monterey County, fortunately, but there have been, I believe there have been some. And then with regards to holidays and special weekends with good weather, we know that people come from outside of Monterey County and to come to locations like parks and beaches. And that we do get reports from residents of our county saying that it appears that these visitors are not covering their face. They're not keeping 6 feet away from other people that aren't in their household or group. And based on prior experience, particularly in larger counties that have had larger events and where they have had an increase in cases like a week after, we do suspect that if we have a lot of people who come to visit on holiday weekends, for example, and if they're not following the infection prevention strategies, that it could definitely lead to an increase in cases, not just here in Monterey County, among most likely employees that work in the hospitality industry, because these are the people, our county residents, who come in contact with large groups of visitors, but also the visitors can transmit the virus amongst each other and then go back to their homes in their own counties and become sick and infectious and take COVID-19 back as well. So yeah, we are always concerned about special holidays that could draw large crowds that are not complying with prevention measures. So the work that's going on that Karen Smith mentioned is important all the time, but in particularly on certain holiday weekends.
Thank you very much for that. Another question for you, Dr. Moreno. Have there been any outbreaks in the previous week in congregate living facilities, such as nursing homes or shelters? And if so, how many have been affected? Okay.
Reasonable question. All I can say is, I'll start by saying that we routinely do not report out publicly the outbreaks among any of the organizations or facilities. It's not just limited to congregate living facilities, but that includes businesses, nonprofit organizations, hospitals, healthcare facilities. Yeah, we don't routinely report out that information. So I can tell you that there are ongoing, every day there's suspected outbreaks and known outbreaks that we are investigating or working closely with the facility management, supervisors, and leadership to address, to try to make sure that they're taking appropriate steps to remove people who are infectious or need to be in quarantine as appropriate from the work site, or from if they're employees. And if people can't leave the locations, such as someone in a skilled nursing facility, that the organization is taking appropriate steps to isolate that individual, or as necessary, cohort people who are positive into one part of a congregate living facility, and limiting contact with those individuals until they're out of isolation. So that's what we do, but what we don't do is report out publicly. But there are just so many going on, and there will continue to be outbreaks in these facilities. We'll continue to work closely with the businesses. I'll just add that it's really important that the business owner manager of or operator of a congregate living facility suspects that they have an outbreak. Really, the best thing to do is still to contact public health. They shouldn't ignore what they're observing. The longer they ignore it, the larger the outbreak will be in their facility or their business. So the best thing is to notify us as early as possible so we can help them in making sure that they are taking the appropriate steps to remove people who are infectious from their organization as possible and slow down the spread of the virus.
Thank you, Dr. Moreno. Another question for you. The current daily situation report says 10% positivity rate or positive rate, but the estimated positive cases of 600 or 2,400 that you mentioned earlier would be a positive rate of 25%. How will the positivity rate be affected by this? And I'm assuming by the increase, the backlog cases coming in. And you're on mute.
Give me one moment. I'll try to pull up our website to give you an most recent positivity rate. All right, so our overall test positivity rate for the last 7 days is 8.9%, and it does exceed our established threshold of 8% for attestation and variance purposes with the state of California. In terms of the impact of a backlog of about 600 cases coming in, I think it's hard to tell anticipate what the impact will be on the case rate once we get all of these entered into our side of CalReady. But if the cases, or excuse me, if the test results that weren't reported to us initially in this backlog, in this group of test results, is randomly distributed among a variety of laboratories that are conducting the testing, then our positivity rate may not change very much. This wasn't isolated to just people. Positive test results as positive, negative test results. And so we in the state anticipate that this was, other than Quest, where we know that Quest was one laboratory who didn't report, it was otherwise impacting many test results coming from different laboratories, which means that it's coming from groups of people from a variety of risk factors or likelihood of being infected. So it may not change very much. What will be impacted most likely will be our case rate, because as the 600 positive cases get entered into CalReady since July 27th, our case rate will most likely increase from what we have currently been reporting.
All right, thank you. And another question for you. Why, other than crowded housing and essential jobs, are Latinos disproportionately impacted by COVID-19, including the numbers of confirmed cases, hospitalizations, and deaths? Is there any specific data supporting those conclusions?
So thank you. So here in Monterey County, we haven't conducted additional research that would require additional data collection to determine whether there are other factors associated with, or that could be associated with, an increased morbidity and mortality among the Latino population. What we're able to share is basically the data that we have, and that's what we have on our website. So that's what we have available. What we've observed is that in many cases, it's not uncommon for an individual who's diagnosed with COVID-19 who's Latino to also be living in a crowded living condition, either employee housing or which can be H2A or non-H2A housing, or that individual could also be living in a household that can't afford or is living with other families because that is all they can afford. And so those are basically our observations. There may be other counties, larger counties, or possibly the state who's beginning to look into this, but that would require additional research and additional data collecting to report on more than just what we're observing in our case investigations and our data collection. Let's see, was there another part to that question, Maya?
Why, other than the crowded housing and essential jobs, are Latinos disproportionately impacted COVID-19? And you did discuss the numbers of confirmed cases, hospitalizations, and deaths.
Yeah. So the other thing that we know that Latinos have a higher prevalence of chronic medical conditions. And we know that COVID-19, based on state and national accumulated data, that people with underlying medical conditions are at greater risk of morbidity and mortality. In this case, hospitalization. We're talking hospitalizations and deaths. And so if we have a population that's more likely to have exposures because of crowded living conditions, or because they have never been able to shelter in place because they're essential workers on top of that, and they can't take time off when they think they're not feeling well because they don't have paid leave. In addition to that, that same group who's a lot of whom are Latino, are more likely to have chronic medical conditions that increase their likelihood of having more serious complications. All that together could partly explain, but again, we would need to. I don't have that in terms as a conclusion based on any research that we've conducted here in Monterey County. It's just based on our observations of the data and reports from our case investigators.
All right, thank you. And then what seems to be our last question is, why doesn't the health department or public health report publicly about facilities and outbreaks at facilities? Back to that earlier question.
Yeah, sure. So we in public health have a few responsibilities, one of which is to protect the privacy of individuals who have been diagnosed with a reportable disease. We've had that responsibility or mandate actually prior to COVID-19 pandemic, and we continue to have that responsibility. So if we have an outbreak that's actively in progress, and we report that publicly, then the public would know exactly where people are infected. They might be able to go and do research or call around or go to the location and observe people going in and out of the building, and begin to ask questions and identify someone who has COVID-19. And so that could disclose the individual, their identity, and their privacy would be, they would no longer have enjoy the privacy that we in public health strive to maintain, because it's the right thing to do, and we're also legally required to do it. We also don't report out because there is no action that the public would need to take based on an outbreak. So if there's an outbreak at a skilled nursing facility, and we've been able to work with the operator of the skilled nursing facility and the leadership and the corporate leaders to take action to identify those that were exposed and isolate individuals and quarantine others as appropriate, and then continue to take measures. There would be no reason to notify the public because there is no action that the public would take other than what's already been recommended to the public, which is stay home unless you absolutely have to leave your house, wash your hands frequently, cover your face, stay 6 foot distance. Those recommendations are still in place and wouldn't change based on an outbreak.
And then there was a second part of this question you might want, if you wish to weigh in on. What would you say to someone who has a loved one in a congregate facility who they can't visit?
Yeah, so it's a really, really challenging time for people who have worked so hard with a skilled nursing facility, for example, or other even if it's not licensed by the state of California, but other adult living situation, who's worked so hard with that organization to visit their loved ones and provide that additional caring and loving relationship and support that really goes a long way. These are very challenging times, and a lot of these individuals who are in these facilities are there because they can't care for themselves, or they have a significant need for support because they have these ongoing medical health conditions. All these those conditions put them at risk higher risk for severe illness, hospitalization, and death. And so the facilities are working closely with their the departments that oversee their operations, and of course the California Department of Public Health, to implement infection prevention measures during COVID, during the time when the risk of illness, hospitalization, death is the highest. And so what I would recommend is that individual who's got or family continue to work closely with the organization that is caring for and housing their loved ones. I think that there are, in a few cases, opportunities for families to reconsider their living arrangements, their family situation, and take some of their family members out of these settings if possible, and care for them in their own home. So that's for a few, that might be an option. And also, if anyone has concerns about the quality of care that their loved one is receiving, that they notify the department at the state that oversees that facility. So whoever's certifying or licensing that organization, whether it's the Department of Social Services or the California Department of Public Health, that they call and voice their concerns if they believe the facility hasn't adequately addressed the concern about the care of their family member. And if anyone suspects that there's an outbreak and they don't think that public health is aware of it, the public by all means can call and report a suspected outbreak, and we would definitely look into it. So those are just some suggestions, ma'am.
And there's actually a little bit of a follow-up to that particular topic about having a loved one reconsidering and perhaps taking a loved one who's in a facility and doing home care themselves. Could someone take their loved one out of a nursing home if they knew there was an outbreak? And what would be would there be any challenges for removing a loved one from a nursing facility?
So if there's an outbreak at a facility, then the family would have to work with the operator of the facility, who would be working with public health to make any determined recommendations. But that would be on a case-by-case basis.
And there was another follow-up question about the outbreak, about knowing about an outbreak. Do skilled nursing facilities notify family members if there is an outbreak at their facility?
Thanks, Mia. So that one I'd have to defer to. There are, because I'm not actively working directly with each of the facilities, or the facilities. Our epidemiologists and nurses are doing that. But what I can say is that our staff routinely work with facilities, whether it's congregate living facilities or restaurants, businesses. We work with various organizations that are experiencing an outbreak to determine what communication is necessary, and who is to receive that communication, and what's in that communication, and what purposes that communication have. What actions are we asking? What do people need to know, and what actions are we asking them to take? So whatever the appropriate communication is, we would work with the organization to make that communication.
All right, thank you very much, Dr. Moreno. That seems to be all the questions that we have in chat, and I don't have anyone with their hands up. So that will end our media briefing for this Friday. Stay cool, everyone. Our next briefing will be Monday. We'll see you then.
All right, thank you, ma'am.
Thank you, Dr. Moreno, and thanks, everyone.